Okay, so finishing up our lecture on breast anatomy and physiology, we're actually going to talk really briefly about the benign breast disorders. So really boring slide, but it's really important. So benign means kindly or harmless. So benign means it's not cancer. So these are things that can develop in the breast that are not cancer, okay? So we're just going to talk about a couple of them. The first one is fibroadenoma. And I want you to have at least heard of this because it's not uncommon in young female-bodied people, so young adults. And it's this firm, rubbery tumor. It feels like firm and rubbery. It's usually 1/2 to 1 inch in diameter, and it's mobile. You can kind of move it around. Feels a little bit kind of like a marble or like a bouncy ball, like a super ball. As I mentioned, it's pretty common, and we'll usually do a biopsy and or remove it just to be double sure that it's nothing to worry about and that it's not a cancer. But if you're sure that that is what it is, they can just stay there. You don't necessarily need to have them removed. Most people want them out because but they're harmless. So the other thing, so that was fibroadenoma. This one is fibrocystic breasts. And so this is a condition that's present in about 1/2 of all female-bodied people. So it's technically then not really a disorder. It's just kind of a variant of normal. And what it is that the tissue feels kind of lumpy or beebly or rope-like due to enlarged glands, little kind of cystic or fluid-filled enlargement of the mammary gland. And what we find is this can be very responsive to hormonal status. So during hormonal changes during the menstrual cycle, they can become more tender or swollen or painful, especially right before menses when progesterone levels are high. That's a common trigger. Interestingly, also, having a lot of caffeine or nicotine can also make these worse or in terms of more symptomatic. Usually there's no treatment required. It's just kind of annoying and somewhat uncomfortable. Ibuprofen can be useful for dealing with the discomfort. Hormonal contraceptives can also be useful because it kind of changes your hormonal state and keeps it kind of more status quo than a typical menstrual cycle. So sometimes that's useful for people. And then, of course, avoiding caffeine and nicotine if that has been something that that person has been using. So finally, I wanted to say young breast tissue. So obviously that's not a benign disorder at all, but young breasts in general can be quite dense and very lumpy, right? So they can be fibrocystic, but they also tend to just be a lot more dense than older breasts. And so that's because over time, more and more of that glandular and fibrous tissue gets replaced by adipose tissue or fat. So the breasts not only become saggier over time, they also become softer over time. And so that becomes important when we start talking about mammography or mammograms, which are x-rays of the breast to look for breast cancer. Because in really young people, it is practically impossible to see a breast cancer on a mammogram. So if we look at the images down here, this image on the far right, this one right here, this is a young person. That breast is so dense, it just all looks white. And then what we see kind of moving to the left, right, is older and older people. So you can see on the far left, that's somebody who is elderly. And the breast is not very dense at all, right? So if there was a cancer there, cancers usually show up on a mammogram as white. We would be able to see it because the rest of the breast is not already white. But in a young person, the rest is already pretty white. So we're not going to be able to see a cancer on a mammogram the vast majority of the time in a very young person. Also, I bring this up because a lot of young female-bodied people want to do self-breast exams, and when they try, sometimes they're scared because they're like, it feels like there's all kinds of lumps and bumps in there. That's usually normal for young breast tissue. It's very tricky. All right. So in summary, we talked about fibroadenoma, that firm, rubbery lump, and we talked about fibrocystic breasts that can be tender and get swollen, especially at certain points in your menstrual cycle. And then we talked about how young breast tissue in general is just much denser and can be lumpy, and that can just be normal. All right. So next lecture is lecture 11, and we'll start talking about breast cancer.